Hello guys, this is Indian Medico, and in this video we are going to see about insulinoma. Insulinoma is a functional endocrine pancreatic tumor. It arises from neural crest cells called amine precursor uptake and decarboxylation, that is APUD cells. It is the most common endocrine tumor of pancreas. 90% of insulinomas are benign. Let us see about the symptoms of insulinoma. There will be catecholamine surge related symptoms due to hypoglycemia. That is, there will be palpitations, diaphoresis, and tachycardia induced by hypoglycemia and relieved by carbohydrates. There will be Whipple's triad of symptoms, that is, symptomatic hypoglycemia during fasting, serum glucose measurements of less than 50 mg per deciliter, and a relief of symptoms when glucose is administered. Now let us see about the diagnosis of insulinoma. It is diagnosed by concomitantly measuring insulin and glucose levels during a monitored fasting period of 12 to 18 hours. We have to measure proinsulin or C-peptide levels to exclude possibility of administered insulin. Multiple insulinomas are associated with MEN1 syndrome. Now let us see about the treatment of insulinoma. Enucleation or resection is the treatment of choice for insulinoma. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. If you like my videos, kindly subscribe. Your subscription will encourage me to make more videos. Thank you.